Imagine living with a pain, a chronic pain that's with you all the time. When you wake up in the morning, it's the first thing that greets you. When you go to sleep at night, it's the last thing you think about. What I'm describing is, of course, rheumatoid arthritis. Rheumatoid arthritis is a chronic inflammatory autoimmune disease that affects joints and surrounding tissues. The body itself causes inflammation to the joint lining tissue and can reduce lifespans of those affected by up to 3 to 12 years. Rheumatoid arthritis is a disease that affects hundreds of thousands of Canadians each year. Not only that, rheumatoid arthritis has a large economic burden as well. There's a huge financial drain on our economy. Estimates of $2.4 billion in direct costs and $3.3 billion in indirect costs. Clearly, rheumatoid arthritis is a very debilitating disease. Let's take the case of Sandy Koufax, Hall of Famer baseball pitcher for the LA Dodgers, who at 30 had his career ruined by the disease. We can see rheumatoid arthritis affects people of all ages. And because of the large economic burden, the emotional and physical hardship of living with such a disease, our team has put it upon us to find a solution to this problem.
Currently, there is no cure for the cause of rheumatoid arthritis. We're here today to propose an exercise intervention that will treat the symptoms, thus providing a better quality of life. We're here to talk about hydrotherapy. Hydrotherapy is a form of therapy where the patient undergoes exercise while immersed in warm water. The patient will enter the pool in the shallow end with water temperatures of roughly 30 to 36 degrees Celsius. The patient will then perform a set of exercises instructed by a qualified personnel present. It is important to note that the patient will not be completely submerged in water, but only the joints associated with the exercise will. This treatment is done for 30 minutes per session for 2 to 3 times a week at moderate aerobic intensity. The total treatment duration will consist of 8 to 12 consecutive weeks. These weeks vary because it is designed for patients to develop physiological progress. Since rheumatoid arthritis is a disease that can develop any time of age, our treatment proposal has no age range. We propose that anyone clinically diagnosed with rheumatoid arthritis is eligible to enroll in hydrotherapy. However, there are questionnaires to assess the physical and psychological state before qualifying for the treatment. This is because although we value results, we prioritize the safety of the patient as well as safety of surrounding patients. If qualified, the patient will have the option to choose from treatment at a community pool or a specialized private pool at the expense of additional costs. Privatized pools will have a 1:1 ratio of instructor and patient, while community pools will have a 4:1 ratio for patients and 1 qualified instructor.
So why hydrotherapy? Hydrotherapy treatment is one of the most effective methods in reducing pain caused by rheumatoid arthritis. In a systematic review looking at the effectiveness of hydrotherapy in treating rheumatoid arthritis, all studies showed a decrease in pain from baseline scores compared with control groups. In some studies, hydrotherapy was compared with land exercise groups, and the hydrotherapy group showed a significant decrease in joint tenderness, as well as range of motion compared to the regular land exercise groups. As expected, with the decreased pain, there were significant improvements in mood and tensions. They were measured using the Arthritis Impact Measurement Scale. Hydrotherapy treatment begins to show improvements in outcome measures after 8 to 12 weeks. With improvements in physical and psychosocial states, their quality of life will certainly increase. A recent study using the Health Assessment Questionnaire and short-form health survey showed that improvements in quality of life directly resulted in reduced mortality rates.
Hydrotherapy currently lacks the amount of support we'd like it to have. Given the benefits and increases in quality of life and the chance to return to work, hydrotherapy provides a lot of good benefits. The cost for treatment, though, is a little bit pricey. It's about $85 per initial assessment and $55 for each subsequent visit. We think if the government subsidizes about 50% of the operating costs for privately funded clinics and 100% of the cost of community center pools, we'd have a big shot at making hydrotherapy a viable, cost-effective, mainstream treatment plan. The government funds 100% of the community pools for 2 days in 2-hour treatment classes each week. Here we claim for an aforementioned 4:1 patient to trained personnel ratio. The private clinics, meanwhile, will have a 1:1 patient to personnel ratio. This gives those who need the little more personalized attention a solution to their needs. Currently, similar survey models have found that private pools cost about $150,000 to operate each year. Community center pools are already subsidized by the government, and they offer a variety of different programs for the community to attend. We think 2 instances of 2-hour hydrotherapy treatments each week is a very feasible solution to provide healthcare as well as keep operating costs at a minimum.